Welcome, everyone. I see some people are on video and some people are not, but that's okay. If you feel brave enough to be on video, it would be great. Then we could all see your faces. My name is Shay Hardy, and I am the Wit Regatta producer in Amsterdam, and I'm not in Seattle. I'm in Amsterdam. Thank you for technology, because I would hate that I got to miss out on the Seattle Wit Regatta, so I'm glad I'm here. We still have some people joining in, so that's great. If this is your first time being at the regatta, can you raise your hand? Ah, a couple of newbies, fresh meat, wonderful. And for those of you that you've been here already, is there anyone here where this is their first session? You just raise your hand. The first session, you've been here all week, this is the first session of the week. Great, okay. So for those of you who have been here all week, how many of you have gone to more than 5 sessions already? I can't see, some of you don't have video, so maybe if you give me, I think some of you have a thumbs up, thank you. Give me an emoji. Oh, some of you have been to less than 5, 3 sessions? Who's been to 3 at least? No? Oh, so some of you are just really starting out here. Well, this is your 5th. Oh, Douglas, wow, your 5th. I hope you're enjoying it. One of the special things about being at the regatta is that we get to connect. And the feedback from that has always been, someone's been 7. Oh my God, that's commitment. Good for you. I'm glad that you can join. This is one of the most special things in the world, is getting people together and connecting and making new friends and meeting new people, and all at the same time still learning a lot of new stuff. And this panel in particular is going to be so much stuff to learn and so much stuff to share. And I'm really excited that we can do this here at the regatta, that we're starting more biomedical tech and having these conversations, because we weren't always having them before. So I'm really excited, and thank you, Ramona, and thank you everyone on the panel for being part of this. And now I'm going to hand it back over to Melissa.
Good morning, everyone. I'm Melissa Bloom, part of the Wit Regatta team, and I am based here in Seattle. My story with Wit Regatta, though, started in Denver. I used to live in Denver, Colorado, and last year I flew to Seattle for this event. And I've had a whirlwind with the Wit Regatta since. I attended our event in Amsterdam last October and our event in Vancouver in January. So I'm thrilled to be here with all of you this morning. For anyone who's new to the Wit Regatta, it sounds like we have a few of you who are new. Our regatta was founded by Melody Behringer and is a gathering to connect women in tech to mentors, peers, and resources, to strengthen our community, to enable us to learn from one another, and to further our careers. While we are here to elevate women in tech, we also believe that tech is for everyone, and that goes beyond gender here. As I said, for the last several years, we've had this event in person in 3 different locations. This is our first virtual regatta, and we're thrilled to have you here with us today. There's a couple of housekeeping items I'd just like to cover to try to enhance everyone's experience. So the first is, if you're not already muted, please go ahead and mute yourself. It'll just improve the sound quality for everybody. As Shay said, we do love to have you join us via video. I do want to let you know that we really value connection and relationship building. And so you're going to have an opportunity to connect with one another in breakout groups, and that's a great time to have your video on so you can see one another's faces. We are recording the session. If you would prefer that your face is not recorded, you are welcome to turn your video off. In terms of looking at the screen, we recommend during the panel session, you put your setting into speaker view. That will highlight the individual who's speaking. During the breakout session, we recommend that you switch over to gallery view and remain there when we come back together at the end. And then lastly, we love to use chat. We love to hear your engagement. The panel will not be actively monitoring the chat throughout the panel discussion, so you may see us come back to some of your questions and comments after the panel has concluded and after the breakout sessions. But we love to hear your thoughts and have you have the ability to connect with one another. We hope that everyone will dive deep into the conversation and contribute fully, learn something new, and come away with at least 1 or 2 new connections, because relationships are the true currency. We want to remind everyone that this is a harassment-free environment, regardless of gender identity and expression, sexual orientation, disability, physical appearance, body size, race, or religion. All are welcome. WIT Regatta events are a safe space where no one is discouraged from contributing so long as they respect one another's ability to contribute. Our panelists are here to be open, vulnerable, and honest about their experiences. Please be respectful, authentic, and genuine when engaging in both the chat and the conversation. And without further ado, I'd love to turn it over to our host from Forum Solutions, Ramona. Welcome.
Thank you. Thank you so much. Good morning, everyone. Welcome to Charting a Course for the New Modern Healthcare Workforce. It's my first regatta, and as Melissa mentioned, this is an event or a session that's sponsored by Forum Solutions. Forum is sponsoring several events today, and you heard she mention that we have a lot of healthcare today. This is actually WIT Regatta's first healthcare port that's happening today, so hope that you enjoy the content, and at the end of today's session, you'll have an opportunity to fill out a survey and provide us some feedback on the content that you heard this morning, and hopefully you'll be able to do that throughout the day as well. So help us make the port better for you into the future. So let's set sail on this new port. My background actually starts in the tech industry, so that's appropriate for a Women in Tech regatta. Pure technology background, started my career in the tech industry at Microsoft as a program manager, and spent a number of years there, and then completely left the industry, completely rebooted my career, went back to school for nursing, and went into community health nursing. And I'm telling you that very specifically because when I say I went into community health nursing, I did not stop at the hospital and do a round of hospital-based nursing care in a facility before getting into community health nursing. I shot straight into the community because that's what I fell in love with when I was in school, and that's what I stayed with. And I am now in what you might call my third career, or maybe it's a fusion of these backgrounds as a healthcare innovator and entrepreneur. And I am happily settled in and continuing to be challenged each and every day doing that work. I'm joined today by Rachel Gerson, by Rick Hall, and Kistein Monkhouse. Thank you for being here this morning. And I gave you sort of the long form version of my background very intentionally, because I think that it's a great way to introduce a panel about the healthcare workforce. When we talk about the healthcare workforce, I don't look like a traditional healthcare worker. I didn't come from that background of healthcare workers that, my family was all doctors, and so of course I was going to be a doctor growing up. That was what was expected of me, and that's what I loved, and I saw my parents doing it, and so of course I was going to be a doctor. Or we're a family of nurses. Yeah, of course I was going to be a nurse. Or I love nursing. I watched my family members do it. That's not my journey. My journey was very different, and it took a very long time to find the right place. Took a long time to find my people, or maybe you've heard the expression, find my tribe. And so our conversation today is going to be about how we create a place for people that are a little bit less traditional in their healthcare worker journey, because more and more people are entering the workforce that do look different. Second careerists are coming into the healthcare workforce. People are cross-pollinating into the healthcare workforce from other industries. They want to make a contribution, and we want to welcome them into the workforce. Whole teams are coming in from companies that are interested in contributing to healthcare and creating solutions for healthcare. And we've heard so much about what they have to offer. And that is very exciting. And we would love to take advantage of that, take them up on that, and create a seat at the table for them as well. So our conversation today is absolutely going to be about the work and how we get out of our silos and work better together as teams, how we tech enable the workers in healthcare, how we put patients at the center of our care. But it's also going to be a conversation about how we create a compelling environment and an interesting work opportunity for a different generation of healthcare workers. So that's framing the conversation this morning. It's a broad-ranging conversation. I hope you're up to the task because it is bright and early. I'm going to just give you one more thought, and then we're going to enter into the conversation. It's a quote that I heard recently, actually, and it seemed so perfect for the conversation today that I wanted to share it with you all. It's from an author by the name of Bruce Feiler, and he wrote a book recently called Life is in the Transitions, Mastering Change at Any Age. And the quote is, the average 15-year-old today is going to have a job that hasn't even been invented yet. So, lots to unpack. Rachel, have you had your coffee this morning? Are you ready?
I am. I'm ready.
I'm coming to you first.
Great.
All right. So I think a great place for us to start this conversation is around the place and mode of care delivery. Many people that are on our conversation this morning have probably seen and heard, or maybe even experienced firsthand, that that's changing. And I even shared my own background with where care delivery happens going into the community. That was different for me as a healthcare worker, and we've seen telehealth be so quickly adopted in the pandemic. I'm wondering if you can talk a little bit as a provider about place and mode of care delivery and what you've experienced there, and what your thoughts are about how this plays out as a healthcare worker.
Great. So just a little background about myself. My journey is is sort of the reverse of Ramona's. I am a radiologist and continued to work part-time as a clinical radiologist. I had a little detour before I started med school into education, but once I started in medical school and training is a fairly traditional path, and I followed that path through 12 years of training and into my practice. And one of the things I liked about radiology is, although it doesn't at first glance seem patient-centered, it's a little behind the scenes. It's sort of at the hub of the spoke of healthcare. So very few people get through the healthcare system without any imaging at all. And certainly in a hospital setting, we see every patient in the hospital in some way. But one of the things I felt in my career was that siloing. And in two ways, both within healthcare, I felt sort of siloed from the other providers. We sort of interact, a patient's care felt fragmented between specialties. So that kind of interactive, collaborative approach that you really hope as a patient that you'll receive, and as a provider that a patient will receive, is hindered in many ways by the somewhat antiquated systems that we use, technology challenges, and communication challenges. So everyone kind of works in their own specialty. And I always found myself thinking about those problems. How I'm reading your images, but how do I communicate these better to the doctor? How do I make sure that before you've taken the day off from work and you get to see us, that you're having the right test done, that your clinician is aware that you actually had a similar test 2 days ago out of the emergency room, things like that. So I felt both that the siloing within healthcare, but also with respect to other industries, and started to feel a little bit kind of like a widget in the machine and frustrated with how could we do this better. And the system is so big that it seems often hard and challenging to create change. So I stepped out of my job and went and worked overseas for a little while to gain a different perspective, which was super refreshing. And when I came back, I made a shift into part-time clinical work and part-time consulting in the health innovation space. But interestingly, my first step was to attend a Women on Boards course at the University of Washington. And I was the only physician there. And it was so inspiring and eye-opening to interact with people from a variety of industries and think about how they approached challenges. And that for me really became the center of where I wanted to move my career. How can we talk across industries to really bring out the best in the healthcare system? So that's been sort of the next progression of my career. And my consulting work has been in health innovation and clinical implementation, and talking to people who have these great ideas in the tech space but don't know a lot about how the healthcare system works, and trying to kind of bridge that gap for clinical implementation. And I would say on the other side of that, greater than 50% of med school students are women, and a large percentage of them eventually leave the healthcare space. So they go to med school, they get degrees, and then they either leave medicine entirely or end up working part-time. And so that's a big challenge as well. And thinking about the healthcare workforce and how we broaden our idea of skill sets and interactions and opportunities for women in that space, I think is really important. To redirect towards your question specifically about sort of what the pandemic has shown us about new opportunities, I think it's been really exciting. And one of the main things has been it's really brought to light how we use our resources and caused us to think creatively about that. Even in the radiology setting, in the at the peak of the pandemic in Seattle, and certainly in cities like New York, we had to think about not everybody who comes to the ER has to have can have a CT scan, because that's going to put our CT scanner out of work for 2 hours while we clean it. How do we use these resources? Who really needs what? And how do we spread those resources evenly? Personal protective equipment, all of those kinds of things. It's also highlighted the need for a more robust public health system, and how we think about that. Access, how people have access. And I think it's really an opportunity. You mentioned telehealth. I think it's really an opportunity in the space of access and equity. Even myself, I had a telehealth appointment and I was like, this is the best thing ever. I don't have to leave work. I just log on, I have my appointment. It's so much more convenient. It was more on time, everything about it. Now there's technology challenges for access, who is even able to get on to Zoom, those kinds of things. But I think it provides a real opportunity to improve equity and access for patients. Of course, it's also highlighted the inequitable state of both health and healthcare in our society, but I think presents a real opportunity for us to think about how technology can answer and address some of those questions.
That was great. Thank you so much for all of that. And I'm wondering if I can ask Rick to chime in a little bit here, as somebody who thinks about how we train our clinicians academically to do this work. Is there anything that we need to be thinking about in terms of training to work in these new care settings? Some of the things that Rachel is talking about, some of the things that we need to be prepared for. What can you share with the audience?
Sure. So let me just preface by giving just a tiny background about myself. I am a registered dietitian by trade. So been a dietitian for about 22 years. Been teaching at Arizona State University for the last 20, and I teach in the College of Nursing. So I'm a dietitian who teaches in a nursing college, two predominantly female-oriented professions. So all my bosses have always been women. I'm kind of used to being in rooms like this, where I'm like one of the few males in the room. But what I'm really inspired by is just really kind of how we've embraced over the last several years some of the opportunities that have derived from the disruptions that are happening. We're living in an interesting time period. I loved your quote, Ramona, about the jobs that don't yet exist. So at Arizona State University, if you look at the U.S. News and World Report, Arizona State University has been ranked the #1 innovation school in the country for the last 6 years straight. And that's very intentional. It used to be considered like a party school 20 years ago. And we had a new university president who came in and just changed everything, wrote a whole new charter. We're very much a university that's about innovation, about change, about entrepreneurship. And so my background, in addition to being a dietitian, is that I'm a serial entrepreneur. So I've always, pretty much the entire time I've been at ASU, have also owned businesses. In the tech world, I started out as a guide for a company called About.com. Some of you might remember that company, About.com. It was originally called miningco.com, and we mined the internet. This is back when Yahoo was the largest search engine. I was the About.com nutrition guide. I did that for 6 years. And because of that, I learned to HTML code. I had to, because we had to actually build our own web pages. This is before you had templates that you could just plug into. So I learned HTML code through that. This is pre-Google. Believe it or not, I remember getting an email from one of the Google founders asking us to list them because they were taking over the internet. And they said, we're going to be the best internet resource out there. And this is back in the day when Yahoo and Excite and Lycos and all of these browsers were competing for the best search engine. And then Google comes out and says, oh, we're going to be the best. And we all kind of laughed at them. They won. So at the end of the day, as an entrepreneur, I've always kind of had these two worlds. But it's like teaching world where I taught nutrition and then eventually other health courses and community health and those types of courses. Then I had this entrepreneurship world where I ran my own businesses. My wife and I have owned businesses, like I said, for over 20 years. And it wasn't until ASU became known as an innovative college and really embraced the concept of entrepreneurship that I was able to put those two worlds together. And so I now focus on teaching entrepreneurship, and I teach it specifically to healthcare workers. So it's not uncommon for engineers and business majors, maybe even design students, to be thinking entrepreneurially. It is less common in the healthcare world. I've seen whether it's nurses, dietitians, we tend to be like focused on a different part. We're interested in of course, the care of patients. We tend to be type A personalities. We're rule followers. We're risk adverse. We're all those things that healthcare workers are supposed to be. And entrepreneurial is not, it's not one of those things. And so when I look at entrepreneurship, I don't look at it as just a way of making a business or creating profit for yourself. That could be the case, but I look at entrepreneurship as a way of solving problems. And so a true entrepreneur to me is someone who identifies a problem and then creates a solution to that problem. So I can give you several examples. I think throughout the discussion today, I might be able to drop in a few examples of what we've done. One of them is actually Ramona. I don't know where you can see her, but she's one of our past students. In an academic program, I administrate a Master's of Healthcare Innovation program, and it's an interdisciplinary program. Our students are nurses, doctors, dietitians, pharmacists, people who aren't even in healthcare, in the healthcare workforce that are trying to get into the healthcare workforce. Some people are just in IT, but it's a Master's in Healthcare Innovation. Not here to plug the degree, but it's a totally online degree. We have students literally from all over the world in that program. We were the first in the country to have it. There are 2 other universities now that have the Master's in Healthcare Innovation, but that's the primary degree that I administrate. And then we created a bachelor's degree in entrepreneurship and health entrepreneurship and innovation, where now Ramona also teaches with us as a faculty member. So that for me, it's all about how do we combine entrepreneurship and innovation together or as separate topics to create healthcare workers and healthcare employed individuals to be entrepreneurs or intrapreneurs wherever they're employed. So you don't have to create a business for yourself. You could be in your business and you could be creating those opportunities within those organizations that you already employed, whether it's a healthcare system or whether it's a community health system, it really, or whether you're in private practice. So I'm just going to give you just a couple of the programs that, in addition to the academic programs that we run, and then I'll turn it back to Ramona. So about 3 years ago, I launched a Health Entrepreneur Accelerator Lab, and it's called the Heal Lab, and it's at the downtown campus in Phoenix, Arizona. And we really service our students, faculty, staff, and even community members who are interested in entrepreneurship. And later in the discussion, I'll try to give you some examples of what we've done with that. The other is I'm the managing partner for the Mayo Clinic, Arizona State University MedTech Accelerator, where we literally recruit med tech companies from all over the country. And we bring them to Phoenix, Arizona, and we try to accelerate their business and try to get them implemented into the healthcare system for clinical trials or research or implementation directly with patients. And then in relation to the question and the pandemic and how we've kind of related to that, what I've seen us do really quickly, as everyone else has had to do, is adapt. And nursing students were pulled, med students too, were pulled out of the hospitals, like literally, like in February, March, they all said, okay, send the students back. We can't take them. We can't deal with students right now. And so these are our future healthcare leaders, right? Our nurses, our doctors, our pharmacists, these are students. So we have a sim lab, like a lot of nursing colleges do, but we were able to, our nursing faculty were able to take those simulation labs and create experiences, virtual experiences that we've never been able to do in the past. And there have been certain types of patients that you thought, that's not something you could do virtually. We're going to have to just do that one in person only. And we were able to create virtual environments for that. So I was encouraged by the ability for us to adapt, but also create new solutions through our ability to adapt and innovate in this environment. So those are just some of the things we're doing at ASU. I do work with other universities as well, but those are the things that we're doing at ASU to, change the future of healthcare workforce so that it's more innovative and, in my case, an entrepreneurial.
Thanks for that, Rick. And I just want you to know that I'm glancing at the chat as you're talking, and some people are remembering about.com. So
okay,
be about that.
The reason it's been a while.
That was great. Kistein, good morning.
Thanks for having me.
Yes, absolutely. Thank you for being here. We talked a little bit about these changes to care delivery, changes that have happened over time, changes that have been that have happened so rapidly, coming at us from the outside forces of the pandemic, and ways that we've had to shift quickly. And we've talked a little bit, Rachel touched on some of the benefits to patients, and I wonder if there's anything that we missed that you want to chime in with. But I also wonder if there are risks that we need to be thinking about. How do we make sure that we're not leaving anyone behind, and make sure that we're being inclusive as we change the nature of care?
Sure. I'll start off by saying I'm so honored to be here. My background is so very untraditional. Must be unlike anyone else on this chat, I assume. I started my career in healthcare as a home health aide, fresh out of high school. And I just fell in love with providing care to the elderly and wanted more for the industry. And so quickly became a nursing assistant after 4 years of being a home health aide. And that's when I was awakened to this idea that the American healthcare industry is fragmented, is siloed, and there's so many issues with it. But as I started working in a much larger organization, which at the time was my my local emergency room department as a nursing assistant, realized that the issues was much deeper than that. It's more specifically, so my background is in public health and public policy. That's where my education is. Understanding that policy touches every part of our existence and every part of our life experiences. And so when I would see patients come into the hospital, people of color, lower income communities, and be readmitted only a week later, I would always question, why is it that this is a repeated issue? Why is it that it's not being solved for? And so right out of grad school, I started Patient Orator, which is a digital health startup. The idea back then was to bring awareness to healthcare inequities and to bring awareness to poor patient experience. But I had no entrepreneurial background, insight, or any of that, and completely did a great job at raising awareness and distributing and amplifying the voices of people of all backgrounds. But as I was doing that work, I became a patient, and that's when I realized that my own experience was impacted, and that I was on the receiving end of what health inequities are. And that's where the digital health idea came from, of bridging gaps using technology. So within the last year, we've built a mobile health app that helps patients narrate their story or document their symptoms ahead of their arrival to their visit. And I'll talk more about that later on. But when I look at healthcare innovation and what's happened during this pandemic and the new care delivery models that are quickly being adopted, I am very happy because of the fact that I am aware of that there are populations of people, specifically people who may have physical disabilities, people who live with multiple chronic illnesses that may not be able, prior to telehealth and telemedicine, be able to be in an in-person visit, for example. And so what technology has done is it has bridged that gap. But more specifically, when we think about lower income communities and people who are in rural America and rural communities, this is a fantastic, fantastic new way in which we're headed. The risk factors, when I think about the risk factors, I think in two different mindsets. One is that there were pre-existing risk factors in terms of people not being heard when they were in person with their MDs and their providers. And I think that those are still challenges that need to be fixed. And as much as technology is great, we have to think about the barriers that they may present. If I was in person, of course, I'd be have different body language or be perceived in a different way. And the same applies for healthcare. So I think those are some of the things that needs to be addressed and reconciled. And how do we improve patient experience with the model that we have right now? But besides that, I think we're heading in a great direction, especially for our lower income communities and our rural communities.
Thank you. That's great. So we're innovating, we're heading in great directions, wonderful things are happening. Rick, how do we get out of our silos though? How do we ensure that our care teams are working together? Is there anything that you can offer us in terms of academic preparation? And I'm gonna give you a little analogy that I often use when I'm talking about this, and I'm wondering, maybe the Sun Devils aren't gonna start their fall season, so maybe this will help you a little bit to deal with any loss that you're feeling there. There are so few teams that train the way healthcare workers train. You know, the football team does not train quarterbacks in quarterback school and wide receivers in wide receiver school and running backs in running back school. And then on day one of your season, say, go out and do great things and win that game. And yet healthcare workers are trained in those silos. Doctors are trained together in med school, and nurses go to nursing school, and social workers go to social work school, and I could go on and on and on. And then, you know, off we go to the floor, or off we go to the community health center, or whatever that setting is, and get great outcomes for that patient. How do you do that? What can you tell us? What are you thinking about there?
Yeah, so I mean, for me, probably one of the reasons that we're known as being an innovative school is that we try to break down those silos, and everyone tries to break down those silos, but it is very difficult with the old ways of schooling. And so for us, I can show you what we do. And we start at the ASU 101 level. So ASU 101 is a freshman level, first class. It's a class that you take just to learn how to survive in college. But we implement for all of our health students a health innovation solution module. So they have to work on a problem throughout the entire semester and present their solution to the problem at the end of the semester. But they work in interdisciplinary teams. So these are students from different majors, but different health majors. So there might be a community health person with a nursing student, with a pre-med student. So these are students at the ASU 101 level. These are 18, 19-year-olds. So we're starting really at that early stage. The other program that we have, well, besides the Master's Healthcare program that I mentioned earlier, which is completely interdisciplinary, because we have students from all disciplines. But we also have a program called SHOW, which is at ASU, and it combines the efforts of ASU with our nursing college and our nutrition college with NAU, which has NAU, Northern Arizona University, has occupational therapy, physical therapy, and then U of A medical school. We take the med students, the nursing students, the occupational therapy students, the nutrition students, we put them all together, and they work collaboratively to help service people that are homeless on weekends. So there's opportunities in downtown in the Phoenix area who for the homeless population to get healthcare during the week, but during the weekend, Saturdays and Sundays, a lot of those clinics are closed. So we put our health students from all these different disciplines together, and they mentored by faculty who are doctors and nurses in all of those disciplines, will work with those individual populations. So we put a lot of intentional effort into this, and I don't think we're the only place in the universe doing this. I think that the idea of interdisciplinary practice or even transdisciplinary practice is becoming more common. I'll give you one more example specifically at ASU is in our lab, our Health Entrepreneur Accelerator Lab, we combine efforts with even engineering students and business students. And so we're putting, like I said earlier, our health students aren't often entrepreneurially mindseted. They want to solve problems, but they just don't know exactly what to do, or maybe don't have the original tools. So when we put them with an engineering student or a design student or a coding student or student from the journalism school, and they put them in teams together, they're able to create really interesting solutions. So I think for me, it starts originally at the academic level, but honestly, it really requires also partnerships with the outside community. And that's both with community partners. We have my Health Entrepreneur Accelerator Lab, we have an advisory board, and that's comprised of, I recruit CEOs and founders of health tech companies throughout the Phoenix area, men and women who are CEOs or founders of tech companies, and they're our advisory board, and they help mentor our students who have entrepreneurial ideas. And then clinical partnerships with the hospital systems. So like I said earlier, we have a partnership with Mayo Clinic. We also have a Banner Health, Dignity, Honor Health. ASU does not have a medical school, so we're considered Switzerland as it's compared to in healthcare world. Anyone can work with us, and they all like that, and they all do work with us. So it really creates an opportunity when we can create those clinical partnerships with them, and in some cases they're able to bring what their problems are to us, so that we can get students working on those problems to get solutions to those problems.
Thanks, Rick, and that's really you're sharing with us not only clinical partnerships, but also academic partnerships that you've developed, which is incredible to share. So thank you for that. I'd love to hear Kistein talk a little bit about how we get patients into the care team as well, because it's so important to ensure that we've got patients in there. We mentioned all of the other members of the care team, but we get the best outcomes when we have the patients as part of the care team. Are there any thoughts that you can share there?
Absolutely. I believe that even in creating technology, we have to be inclusive by design, which includes not only the patient, but their family caregivers and other members who may be a part of the care team. And I'll give you an example because after my role in the front lines, providing care directly to patients, I worked as a case manager, I believe that's what the title is called, also known as a service coordinator. And my role in one of my patients' life was to connect her to resources within her community, to also connect her and be that middle bridge between her and her providers. What's interesting is that she had a community health worker who was assigned to her, who had been with her for a number of years, who had developed this relationship where she wouldn't listen to me when I would recommend that she take her medication as recommended by her doctor. She would listen to him because they had a much stronger relationship. And I think when we're thinking about design and technology, we have to incorporate for people who may be in a role like I was prior, who may be able to influence that patient to get them to improve their health and their well-being. So I think that's a part of what's missing right now. We may have the nurse or the doctor or just a patient, but I think we have to think holistically in order to really influence and impact health outcomes.
Absolutely. So I'm gonna just take a second to talk about the new healthcare worker and just bring us back to some of my opening comments and some of the trends that I talked about, those second careerists, the cross-pollinators coming in from other industries. Gig worker is another term that's so big right now, people are talking about. And I'm going to ask each of our panelists to talk a little bit about trends that they're seeing in the next generation of healthcare workers. And I'm going to ask you to start us off in that conversation. Is there anything that you're seeing in terms of healthcare worker trends that are coming into your organization, into your consulting work, into your innovative companies that you're working on that you can share with us? And what do we need to know about these healthcare workers?
Did you direct that to me?
Yes.
Okay, I wasn't sure. I think the cultural competence that Kistein sort of touched on is such a key piece of the new healthcare workforce. And thinking about a broad set of skills that healthcare workers have. So I always reflect back on, and this is something I ran into in thinking about shifting in my own career, is when you look at a healthcare worker, or at least a physician resume, it has a very old school style to it. It's where you train, where you went to school, where you trained, what you've published. That's it. It has, and even a job listing just has, we want a radiologist, period. Someone who can sit in this seat. When you look at a resume in other careers and you look at job listings like on LinkedIn in other careers, they're these broad phrases that can be interpreted multiple ways: communication skills, managing people, dealing with risk. And I think the reality is that healthcare workers need all of those skills and have all of those skills. And really thinking about how we capitalize on that, those skills that people have. I think sometimes in the corporatization of healthcare that's happening, in our focus on fee for service and throughput and seeing patients as fast as we can, that we see the healthcare worker as just filling in a seat or a shift. I've certainly seen that in my own career. I know it happens at all levels of healthcare workers, nursing. How do we see each individual as a member of the team and really focus on the skills that they provide and can bring to a situation? Because we can solve a lot of our problems if we recognize, give time for, and encourage the collaboration and make room for that. There, certainly in my own career, we identify lots of problems, but you're only reimbursed for seeing patients as fast as you possibly can. So no one puts any effort into those other projects because that's not the value. That's not what's valued. So I think the opportunity for us to, excuse me for 1 second, sorry, I had a child in the background with radio on all of a sudden. So I think that's, I think the new generation of healthcare workers is looking to have a broader set of skills and to bring their broader set of skills to bear on the challenges that we face. And interesting, just to wrap up, I'll say, I don't know if this is true, but I've sort of anecdotally been noticing that physicians go on to get additional degrees more than people in other areas. Lots of physicians going on to get masters in public health, business degrees, JDs, all these different things. And I think that speaks to the fact that the problems are more complex than just the trade skill of providing healthcare. Now, obviously, that's super important. If you're a surgeon, you need to learn that trade really well. But I think creating opportunities and positions within the healthcare system that really draw on a broader set of skills is a real opportunity.
I love that, and I wonder if that, and you spoke a little bit about the leaving the workforce that you noted when you sort of started off the conversation earlier at the beginning of the panel, and I wonder if we started to create those opportunities, start to draw on broader skill sets that people bring to the table, if that might keep people at the table longer. So I love these thoughts. Kistein, can you add on?
Yeah, I agree
Or
with
share your thoughts, please.
Sure, sure. I agree with what Rachel just mentioned. I think earlier she had even mentioned or alluded to the issue of burnout. And right now, basically, based on 2019 stats, we know that 40% of physicians have felt burnt out. 50% of female physicians have felt burnout also. And I think that we cannot discuss the future of healthcare workforce without addressing the elephant in the room, which is that we have to decrease people's work cases. We have to improve the way in which their work experiences are, because if your bottom line is to improve patient experience, your workflow has to be feeling comfortable with the work that they're doing. And I'll give you an example. When I was a nursing assistant and working in a nursing home setting, my first night on that job was 20 patients. That's 20 patients of which I had to be the eyes and ears for that nurse that I was working alongside. That is unrealistic, because there's no way in which I could have provided the best possible care to each and every single patient that I touched. And just to be clear, that nurse that I worked alongside, she had to administer medication and document for that medication that she was administering to those patients for all 40 patients on that floor. And I think when we look at settings like that, when we look at people who work in densely populated area, what are their working conditions? So as much as I want to say like technology will kind of help and kind of improve healthcare, we have to look at these very basic things that are being ignored right now. So hopefully that answered the question.
That's great. Rick, can you share anything that you're seeing in terms of future healthcare workers? You have so many coming through your doors all the time. What can you share with us?
I guess I'm really encouraged with the mindset of current students. They tend to be interested in the greater good, more so than probably when I was a student. You know, when I would ask a student 20 years ago, you know, why they wanted to be a business owner or an entrepreneur, and I never mentioned this, but my original destiny, I was a business major when I was originally in my undergraduate school, and I took a nutrition class and fell in love with it and switched to health. But you go back to those days. I mean, my mindset was I want to be an entrepreneur to make money, and when I even started teaching entrepreneurship at ASU, I expected that to be students' motivation. But today's students are really socially minded, and they're really interested in how do I make the world a better place? How do I improve healthcare disparities? How do I use my abilities and entrepreneurship and innovation to give access to people who haven't had access to healthcare in the past? How do I solve issues related to the cost of pharmaceuticals? I mean, it's just amazing to listen to students these days. So I'm very encouraged by that. I'm also encouraged by, you know, from the technology angle, just the tools that are available to students now. I mean, look at, we are all over the country right now talking on a computer live. That's just pretty amazing. I mean, just the tech, I don't know about you guys, I didn't even have a computer when I was my undergraduate. Like we didn't have them. I mean, you could go use a computer like in a lab somewhere if you wanted to, but the internet was just not even out, or it was kind of just text-based. And just the ability, the tools that students have today makes it transformative in itself. And the ability to access information. I mean, PubMed, I mean, they could just go literally research any peer-reviewed article in seconds, and they can do it on their phone. I mean, it's just incredible, the tools that they have. And because of that, you have students and even high school students who are coming up with amazing ideas. And we ran a health innovation entrepreneurship internship this summer, because when the pandemic started and all these internships disappeared, like literally students who were hoping to get into med school or nursing school or whatever, we're going to do summer internships this summer, and those opportunities went away because a lot of the places that did internships, they were not doing them. So we decided we're going to address this. You know, I have two kids that are in high school, and I thought, you know, they were sitting around for weeks, like when the pandemic started, even before the schools figured out what they were going to do. And I thought, what are these students all over the country going to be doing? And so we launched a health entrepreneurship innovation internship. We had no idea how many people were going to come, 5, 10, 20, I don't know. We had 80 students apply from 4 different countries for a health innovation virtual internship. And they all had the same mindset. I mean, they were interested, in working on their skills professionally, but they were interested in technology. They were interested in artificial intelligence. They were interested in telemedicine. They were interested in health disparities. And I'm just very encouraged, not only by the tools that students have, but by their mindset and that they want to help people and they want to use these tools to do it. And so I think it's up to us now. It's up to us as current leaders in the healthcare system or in technology to grasp that and use this opportunity to not just train, but mentor these young students who are in school now. I have seen, by the way, I do innovation training for Mayo medical students. So these are students who are first, second, third year in medical school who are interested in innovation and entrepreneurship. And they're taught, med school students now are taught, look for the problems to solve. Like when you're in your third year and you're out in the hospitals and you're doing your rotations, look for all the issues that are problems. Because if you ask healthcare workers, are there any problems to solve? They'll all say, yeah, there's a lot of problems to solve. There's like, I can't even list them all. You say, why don't you solve it? And they'll tell you all the reasons why they can't solve it. There's, legal issues, or, the healthcare, the Affordable Care Act, I can't do it, or our CEO is a jerk, or we have no money, or whatever. But students aren't thinking that. Students are like, I say they think outside the box because they don't know there's a box. And that's a beautiful thing. And so the more we have students working on solutions and more we start these ideas, both at the undergraduate level, at the graduate level, and in med school, and all of those other, no matter what field they're in, because they want to do it. And it's up to us to mentor them to do those things.
That's great, Rick. I love the message of hope, and it's great to hear what you're seeing from those future workers. They can show us the way for sure. I'm going to ask Kistein.
One final thought on that. I meant to say it when I met the med school. I actually had a medical student actually try to quit medical school because he's like, I need to quit just to do the innovation and entrepreneurship. And I had to talk him into staying in medical school. So we don't want to get him out of the healthcare workforce. We just want to keep the healthcare workforce thinking this way. So.
Layer it in, fuse it together. That's right. That's good. I'm going to ask Kistein to bring us home with one final question, and that is, put us in the shoes of the patient. We've talked from the shoes of the patient a little bit this morning, but I do want you to, if you wouldn't mind, speak from the voice of the patient for us. And could you, and I know you do this so much in the work that you do on your startup, if you could share with us, what do our healthcare workers need to know from the voice of the patient to provide the best care? What do they need to know to provide the most culturally competent care? Can you share with us your thoughts there?
Sure. I created a film titled Dehumanizing Healthcare with the purpose and intention of bringing awareness of what it feels like to enter into a healthcare setting and not be heard and not be listened to. In terms of what it must feel like, I have to go back to the story, which in a few years ago, I was filming the film, and I ran into a young woman in the streets of Detroit, Michigan. And I'd asked her about her patient experience, and she said, I lost my left eye because I don't have health insurance. I had kidney failures because I didn't have health insurance. My call to action is to treat people like humans. And if there's anything else that the future workforce are listening to this message, is that you have to remember that when people are coming into these facilities and they're interacting with you, that they're in front of you, you don't know what living conditions they're coming from. You don't know what kind of day they've had, what their socioeconomic statuses are. That this may be the one place where they're looking for that human touch and to be treated with dignity and respect. And as a Black woman myself who has endured bias because people didn't believe me when I said that I was in pain. I know what it's like to not be heard. And I think that you have to really look at people as humans and really get out of the space of examining what your biases are, and ask for help if that's something that you need in terms of education and resources to unlearn some of the negative stigmas that we may have, or we may carry around. So as healthcare workers, we have a responsibility to be healers, and nothing less.
That's such a mic drop moment. Thank you. All right, attendees, we've prepared you well for your assignment. Thank you for that perfect final thought to lead us into this. It is time for our breakout. You can see here on the screen that Melissa has shared what our breakout sessions are going to look like. You'll have an opportunity. We have about 20 minutes for this exercise. You have an opportunity to introduce yourselves. And we'd like you to work with the theme that we've been exploring a little bit here this morning. We're looking at new types of workers entering the workforce. We're really changing the game and innovating, and we'd love for you to explore a new role that doesn't exist in healthcare today, or how would you tweak a role that does exist today to help it meet the needs of the future. And we offered you in number 3 here what some questions that you can poke at to just explore that a little bit more. The slides don't carry over into the breakout rooms, so if you want to take a screenshot of this right now, then that might help you to work in those breakout rooms. And we'll also have a little scroll bar coming across the screen in the breakout rooms to help guide you if you get lost in some of the questions that you'll be exploring. And then when we come back to the main session, we'll probably have about 10 minutes to wrap up, and we'll ask you to share your thoughts and experiences in the chat. And class of 2021, they're going to be coming for us. What do we want to pitch to them about this new role? All right, let's go.
Here we go. Welcome back. I think everybody has just another 15 seconds or so, so we'll all be back here in just a moment.
Sounds good.
All right, and Ramona, I'll turn it over to you. And at this point, everybody does have the opportunity to unmute themselves if there's anything you want to call out from any of the breakout groups.
Thank you so much, Melissa. Thank you for managing our breakouts for us. So feel free to drop some notes into the chat about your experiences in the breakout, what that was like for you.
I could give a quick description.
Yeah.
So I was in the breakout room with Rick and Geeta, and we had a very interesting conversation around how we can weave in technology with pharma or with healthcare. And we actually got into the nuances of discussing how data is getting and changing the world, changing the landscape, and how we have evolved from getting no technological awareness in the pharma industry to getting a revolutionary technological experience. With changing landscapes, changing technologies, changing people in the pharma industry, as you know, it's like a fast churning rate. People now who are coming in are more technologically adept. So I think that is something which is causing a lot of change, and it's a tide of change. And I work with Novartis, and I can see like there's a very big impact that technology can create on any pharmaceutical way. So starting from, I work on the commercialization space, like drug commercialization. So starting from the clinical trials, like discovery of drugs, to getting into the patients and actually telling the patients that this is the correct drug to be used for you. I think the whole phase and all the sectors of it are as important, and technology can play a great role in it. So thank you so much for this discussion. It's been very eye-opening and absolutely loved it. I'm going to connect with you guys, Geeta and Rick. It was so good to talk to you guys.
Great.
And of course, hearing the rest of the panel.
Fantastic. Thank you. That's fantastic. All right. Great. Anyone else feeling like they'd like to share? Rachel, how was your breakout room?
Our room was great. I loved it because all three of the other people in our group, we had Tammy, Karen, and Doug, none were from a healthcare background, so that was a fun conversation. We talked a lot about the value and challenges of cross-collaboration across industries, and kind of envisioned some roles that served as a liaison, both between patients and sort of the tech, as we move into telehealth, between the tech component and the helping patients connect the tech component with the physician and being the liaison across those. And also, what are the roles for liaisons within the healthcare industry between clinicians and providers and the tech space, ways to connect across those bridges. And we also talked about social media as a way to get information out there, interact with patients, gather information. So we had a broad-ranging discussion and lots of great ideas. And I welcome any of the participants to comment.
Sounds like a great discussion. Thank you. How about Kistein? Any key themes you want to share from your small breakout?
We had a small group of 3, myself, Kellen, and I said her name right, yes, and Stephanie. And the core team was about health IT and non-traditional background and Pat. Kellen shared her experience, and Stephanie was incredible in sharing experiences as well. And yeah, it was a great discussion.
Great. All right. So we have just a few minutes before we wrap up our morning. This has been an amazing experience. And before we leave you all today, I want to ask each of our panelists to share one parting thought, just a key thought as we move into the future. What's one thought that you want to share with our attendees as they move off into the rest of the day of thinking about healthcare, and as they move off into the future, thinking about what we can do for the workforce, what we can do for the industry? What's the message that you want to offer? And I'll start with you, Kistein, since I see you right there on screen in front of me.
Sure, and I'll put my policy, I just love health policy, putting my health policy hat on. I'll say that in order for the healthcare industry to change, we need to energize workers and not have them be compromised. We need to have people be fired up and not burnt out, if that makes any sense. We need technology that will bridge gaps, not only for the people that are delivering care, but also for the people that are accessing care, and these are our patients. We also need an inclusive environment that is reflective, those that are providing care that is reflective of the populations that we serve. And if I were looking directly at the people who create the policies that govern our healthcare system, I will say to them right now in this moment that silos have no place in healthcare. And I'll leave it as that.
Beautiful. Rachel?
I just love what you said, Kistein. I totally agree. I would say the things I think are really important. One is we need to think just in the health education space, think about the biases that are built into what we learn, specifically about disease and disease processes, where our research comes from, who it focuses on, who our treatments serve and focus on. I think that's super important. I think we need, as I mentioned in the chat earlier, that it's really important to realize that healthcare is just a tiny slice of health, and that thinking about public health, social determinants of health, environmental components, systemic racism, things like that is essential to really creating equitable health. And lastly, I'd say just on the tech and data side, somewhat around HIPAA compliance and things like that, data has become very proprietary in healthcare. And I really think we need to see a shift of data, that patient's data is centered around the patient, that they control it, that they have access to it, and that it really focuses on the individual instead of on the healthcare system that you happen to be a part of.
Beautiful.
Mhm.
Rick, parting thoughts?
Well, you messed up putting me last. You should have put Kistein last. She's the mic drop person. And now I'm never going to be able to compete with that. And let's just do this last thing over again. I would say, number one, the future is bright. I'm really excited. I felt very blessed that Gita and I got to work with Shivani, because she's a current student. She's getting her master's degree in management and engineering. She's new to healthcare, and she's in an internship now with Novartis, like she mentioned. But seeing her and listening to her and listening to how she wants to use technology and her skill set to help people. And to, as she said, if I could just save one life, that would be the amazing. And I'm just really encouraged by that. And I think my parting thoughts are just to surround yourself with people like her. Surround yourself with people who are solution minded, and hang out with those people. Create a mastermind group or whatnot, so that you can get this type of environment that we're in today on a regular basis, because you can't do this once a year. You need to be doing this. I have a group that I meet with monthly, and I very intentionally picked out the right people for that group. And it's people who are positive, people who are looking for solutions, people who are people who inspire me. And every time we meet, we break out of that thing. We're emailing each other back and forth for days about all the ideas that came out of that group. So I would say the future is bright. And if you're looking for someone to employ in December, it's Shivani. She's right there. She'll be looking for work pretty soon.
Beautiful. Fantastic being with you all this morning. Thank you, everyone, so much, and have a great day. Melissa?
I would just like to thank everyone on behalf of WIT Regatta. Thanks, Ramona, for moderating such a great panel, and thanks to all of our panelists for sharing your stories. We do have the opportunity to stay on a few extra minutes. I think there were a couple of questions in the chat. If people would like to address those now, and Ramona and some of our panelists have a moment, we have an extra 10 minutes or so to have an after party, and you're more than welcome to stay on.
And there is a link in the chat from Marissa that gives you an opportunity to give us some more feedback as well. Thank you all again.